Welcome back. We're almost out of time, but before we go, let's turn the floor over to you, our audience. And as always, we love to receive your questions and comments, so continue sending them at comments@thezoomer.com. The first is from Jan, and here's what she writes. Earlier this year, the feds announced billions in additional funding to provinces and territories over the next 10 years. Will it make a difference? Dr. Kiran.
I sure hope so. I think this is actually a key opportunity. Some of that money was specifically earmarked for primary care. I hope that it goes to primary care, and I hope that the provinces start to report back more clearly on, what improvements they have in the proportion of people who have a family doctor or nurse practitioner. I'd like to see actually provinces go further to say we're going to make a commitment that everybody in the province or everybody in the territory has a family doctor, nurse practitioner, or team that wasn't, called for specifically within this funding, but there was a commitment to have provinces improve that proportion, and I'd love to see that starting to be reported in the concrete plans. But I'm hopeful that the money will make a difference, especially money going towards team-based primary care.
Dr. Whatley?
So this is an example of the federal government offering a tip on the total bill for the meal and expecting to choose what's on the menu. They put in $46 billion new dollars over 10 years, which is a drop in the bucket. We spend over $331 billion every single year. And the reason the federal government does that is they want to have strings attached on what the provinces must do, the hoops that the provinces must jump through to get that funding, even though the provinces have to pay for most of it. So I think it's a constitutional problem. It's been an issue since the late 1960s. It's called the issue of federal spending power. No one's dealt with it yet, but right now the feds can throw out a 20% tip on the bill, and the provinces have to jump through hoops to get that money.
And I will say, I agree. I think it's hard to figure out what will actually happen with the money, but I think it needs to be spent smartly. I think it needs to be spent on public solutions, innovative public solutions that we know that work. Things like centralized referral systems, things like multidisciplinary teams, things like expanding OR access. I think our medicine has historically been very siloed, and we need to break those silos. We need to work within team-based care, and I think if that money is spent towards strategies like that, then we'll see an improvement. But unfortunately, I don't think Bill 60 is the answer to that.
All right, let's get to the next question. It's from Shilpa, and here's what she writes. Will the influx of foreign-trained nurses put an end to those expensive, privately run nursing agencies? Erin, that's for you.
No, it will not. As I said, Ontario is currently 24,000 registered nurses short, just to bring us up to the next lowest province. There are not, at present, unless something's changed today, this morning, 24,000 internationally educated nurses waiting to work in Ontario. So no, it will not. The answer is retention of our own registered nurses.
Well, Ontario has also announced that if you are a nurse practicing in another province, you can come to Ontario and skip the registration involved with that. Is that an attractive enough offer?
I mean, I think there are nursing shortages across the country, and I think why come to Ontario where your nursing wages will be capped at a 1% annual increase when you can work in other provinces and be remunerated better? So what is attracting nurses to our province? It's certainly not Bill 124. It's certainly not the low remuneration that we have in our province. And so we need to fix that, and we need to work on retaining nurses within our province.
Mm-hmm. And I think it's important, though, to remember that nurses who are trained in Ontario, who are educated in Ontario, are sought after throughout the globe. We are some of the best trained nurses in the world. So there are greener pastures. It would be really nice, though, if Ontario became the greenest of the pastures.
All right, before we go, we'll go around the table and get a couple final thoughts from each of you.
I think primary care family medicine is the front door to the healthcare system, and we see right now that 1 in 5 people in Canada don't have access to a family doctor, nurse practitioner, or team. In some provinces like BC and Quebec and the Atlantic region, it's as high as almost 1 in 3, which is shocking to me. And so when you don't have access to that front door, It means that you can't get the preventive care you need, you don't get the treatments that you need to stay well, and you certainly don't get the care you need when you're ill. And so we need to fix that. That needs to be one of our #1 priorities. We need to invest more there and set the goal boldly that everyone deserves that care.
Dr. Whatley.
Yeah, I would echo the call for universal care. I think that's the moral high ground. Everybody in the country needs access to care, and I think that's something we can all agree on. I would add to that Canada is blessed with tons of great nurses and great doctors and great other providers, RTs and PTs and all the rest of the allied health professionals. And every single day, last night in the Emerge, this morning in the Emerge, a doctor and a nurse somewhere found a creative solution to work around the roadblocks and bottlenecks in our system to get the care that their patient needed. So I don't think we need to be looking around the world or writing more white papers or coming up with new ideas. We have tons of ideas, and we have tons of really smart, motivated, caring people within this country who want to provide care. We need to unleash them and let them be creative and surprise us with what they can do for patients.
Erin.
Privatization is not the answer in Ontario. We have a staffing crisis in healthcare right now, and that will just further deplete our staffing, health human resources in our public system. We need to value what we have, keep what we have, bring people back to Ontario. And there are a lot of ways, which we've gone over today, to do that. And I'm hopeful that we can achieve that.
I will echo what Erin said. I think I would be remiss if I didn't at least mention the tragedy of our long-term care homes in the first few waves of the pandemic. And the research shows that for-profit long-term care homes had a 78% higher, 70% more deaths compared to not-for-profit long-term care homes. So I don't think private for-profit delivery of care is the solution. I think it will make our health crisis worse. I think we have a solid foundation within our Medicare system, within our publicly funded system, and we need to work on expanding that through innovative solutions and utilizing our resources that we have within the public system to achieve the goals that we want.
All right, and we'll have to leave it there. A big thank you to my panel for being here and for sharing your expertise today, and to you at home watching. Keep an eye out for our next show, and to get in touch, you can shoot us an email at comments@thezoomer.com. For now, it's time to zoom out.